for our poor man Jimmy. And the slide here, it's like, how much does a new hip cost? Right now, it's only $45,000, and that's like when you look back at Jimmy here, it's like, who knows how much this could cost? Who knows if he's paying a fair price for what medical services are needed? Who knows if the physicians who are supplying the services were the best in their field for that specific procedure? And when you have all of these questions, here we go. It's like, how many physicians in the hospital actually saw and billed me? Why did my PCP refer me to that specific specialist? Why did my PCP prescribe me that specific medication? And why did my specialist refer me to that specific radiologist? Did I really have to go to the same lab twice? I wonder how much this is all going to cost me. And in the end, it's like, I really don't understand how any of this actually works. So what's happening in transparency, and transparency, again, is going to be a huge buzzword around the healthcare arena for quite a while now, and it's gonna really blow up in the next year. But that information that Jimmy wants to know is being published, and these bullet points, there's some patients might already be seeing how much you charge, or at least have access to that information. Or some patients might already have access to your quality scores or other performance-based metrics, and you don't know they have it. And Medicare is always about trying to shine lights on different things, and right now they're sharing how much physicians are being paid from Medicare. They're showing different partnerships in healthcare between drug companies and different systems. Like, there are companies right now who are specifically dedicated showing all of this information. We don't generally promote companies, and that's not what this is about, but this is something to pay attention to in your specific geographic regions. But companies like HealthSpark, Vitals, Castlight, and Change Healthcare are companies that are labeled as transparency companies who are providing those tools to show cost, to show quality, to show reviews by patients about another provider, about a provider office before they go. And some of these companies have made themselves embedded in health plans. Some of them are embedded in employer groups. Like, say, for instance, anyone who sees a Regence Blue Cross Blue Shield patient in the Pacific Northwest, that patient has access to all of that information about that provider. And whereas another company like Castlight, their main focus is, pushing towards employer groups. So think of like a large employer group like a Nike or an Amazon. And so these transparency tools, they make them available to their employees. And the reason why they would do that, obviously, is because people feel that if the patient has access to that kind of information, they'll make better decisions, and not necessarily better, but they'll make more cost-effective decisions in regards to the care and that they choose. So everyone finds it as a kind of a win-win-win-win-win situation. So the landscape itself is changing, and that's the question is how does this affect me or my practice, or what should I be doing, what should I be focused on? It's like right now, it's like, the mob shakedown. This is how patients feel after the disaster scenario. Like, say Jimmy really had all those crazy medical issues, and, it's a year later, and Jimmy has to, file for bankruptcy because he can't keep up with his medical bills based on what happened, and he just doesn't know. And so even after patients receive all this information transparency, or all this access to transparency tools, there's still going to be questions. They're still going to be confused. They're still not going to know exactly what to do. So, everyone needs to be prepared for is, do you have a plan to help educate your patients? It's really difficult to educate your patients on an industry that's pretty much brand new, but it's definitely worth it to be ahead of the curve. And, taking the time to explain to them what transparency is. And say, for instance, again, so Blue Shield of California has transparency tools available to their members, and specifically, they have University of California students who have access to these transparency tools. And so, if you're a provider and you're seeing those patients, or you're an office manager and you know you're seeing those patients, it might be worth it to say, hey, you know, here's what we know about transparency, and let's make these tools work together. If anyone has seen me present at a few conferences earlier this year, I always challenge everyone in the room to share their prices now. Like, you know, share your fee schedule, because, you know, it's already being done to some of you and you don't even know it. It will make you look ahead of the curve in regards to, you know, this whole transparency market. And it was interesting, of all the conferences that I did present at, anytime I bring this topic up and I ask who in the room knows what transparency is, maybe 1 to 2 out of 200 people will raise their hand and say they know what it is and they have a plan, or they know what it is and they don't have a plan, or they've heard of it but not sure what it really means. So in doing that and explaining to your patients what that stuff is, you're really a step ahead of that curve. But then, you know, and explain to them what your practice is doing to help patients understand cost and quality. You know, again, right now, even us who work in the medical field, we may know how much something costs, but you know, it's not the same. And then show them that their health, satisfaction, and wallet is important to you. And so again, it's as healthcare evolves and it changes and there's more electronic data, the joke is like health is on, and as opposed to just Amazon. And so if you're showing your patients, you know, that you're concerned about their health, which we already do, but you're concerned specifically about their satisfaction and their wallet, they're going to come back. And so what I say here is, like, you know, their satisfaction. I can't imagine how many of us in this world have gone to, you know, a physician appointment and we're seen on time, or we're greeted by the most helpful front desk staff, or you know, we're really confident that, you know, the copay was right, or the, you know, the bill they're going to get in the mail is correct. And with transparency and tools and putting all the information at someone's fingertips, I mean, those things are huge. So, you know, show them that you value them being your patient, and, you know, and not that, again, people don't do this, but it's going to change. And so, again, that last bullet point is kind of just a summary, but customer service in the age of transparency is more important than you think it is. And I, as a patient and someone who is technologically savvy, I will get onto my computer and I will find this information out. And if I read an office review that had, you know, like 2 stars out of 5 stars, and the reason was because the office staff wasn't friendly, I might not pick to go to that provider. Or it's like now when you sign up for a health plan and you have to pick a primary care provider, or who you're going to go see for your PCP, it's just like, you know, here's a link accepting new patients, and you just go, okay, well, that person looks all right, I guess I'll go see them. But again, with this age of transparency, like, that PCP could have 5 stars and a really, you know, be really cost effective and have great reviews and, you know, have great quality scores on specific measures that they're really passionate about. And then it could be right next to another one who's accepting new patients who has terrible scores, who has, you know, an expensive price in comparison to the quality of the, you know, their quality scores. So it really is like customer service, explaining what transparency is and being a step ahead of the curve is really going to be huge as, you know, as we continue to grow. So healthcare is a marketplace. You know, in the next 5 years, all patients will have access to transparency tools, if not sooner, and maybe not a specific company like the ones I had mentioned, but in some general form, people will have access to this information. The ways in which patients pick and choose providers will be significantly different. You know, patients will read the news and will know what is available to them. It's like, you think of like we're the age of technology, and things that we, you know, have now, we just expect to be there. And as when you take someone who could be, you know, in their early teens right now, by the time they hit 25, you know, transparency will just be a given. It will be an understood thing. They will expect to have transparency tools for their healthcare decisions. And, you know, patients will read Medicare reports and use their transparency tools in conjunction. So, you know, if you're looking at a report and you see that this provider is doing really well, and then you go look at your transparency tools and you say, wow, this is really perfect, that's where you're going to go. And when it puts the power of healthcare in the patient's hands, like it's a revolutionary change for how our healthcare system works. So in the end, I mean, that's really the gist of what, transparency is, where the industry is headed, and where our practices and different technology systems need to adapt and be prepared for, the landscape change. So with that, if there are any specific questions, I am prepared to take as many as you need, or if you want to email me, that's fine. And then generally speaking, I believe that Sarah will have this published by today or tomorrow and have the video WebEx posted to the website. So if there are any questions, please feel free, and I'll answer them. All right. It doesn't sound like we have any questions at the given time. So if you have any questions, again, that you don't want to ask them at call, by all means, send an email. And thank you for attending. And back to you, Sarah.